Well, one thing we know from the large scale epidemiologic studies, and we give more credence to studies that go on for decades with many thousands and thousands of people and that look at hard endpoints like death. And what we find in those studies is that the exclusion of all fat from the diet or the use of oil does not allow for lifespan enhancement compared to using some nuts and seeds in the diet. That the utilization of nuts and seeds as your main source of fat. And we're talking about flax seeds and sesame seeds and walnuts and pecans as your main source of fat in your diet. And so nuts and seeds are definitively, in the meta-analysis and almost every study tested, show dramatic enhancements in cardiovascular mortality and all-cause mortality and cancer rates for some using some whole plant food fats in their diet. And as you mentioned earlier, just mentioned, the omega-3 index is also critically important. Now, even though I advocate a vegan diet or a near vegan diet for my patients with disease and with serious illnesses here at my retreat, we don't play around with small amounts of animal products, because when people are overweight and food addicted, a little bit of animal products makes them want to eat more of it, and they don't have a cutoff switch, and they don't really know how much is okay. It's better to just take it out completely and just put them on a vegetable-based diet. It assures them the most, the most boundary lines of how far they should go. I have no strong objection if a healthy person wanted to eat a few ounces a week, 2 to 6 ounces a week of animal products. So the most Americans are eating, 10 to 15 ounces a day. I don't mind a few ounces a week, but the point is that it's just simpler to give people a vegan diet, especially when they're sick. But then my 3 decades of experience of treating the vegan community, and many of which were elderly people who were my mentors even, who were eating super healthy vegan diets, and watch them become demented in their later years or develop Parkinson's, made me very cautious about the lack of omega-3 fatty acids, preformed omega-3 fatty acids. So there is a benefit to taking fish oil or eating some fish if you are omega-3 deficient. But nowadays, we have available vegan omega-3. So you don't have, that's EPA and DHA. What I'm saying right now, there's something in the blood called an omega-3 index, where you can do a blood test to discern whether the level of omega-3 of DHA and EPA compared to omega-6 fatty acids on the blood cell membranes have at least 5%, let's say, of omega-3 compared to omega-6 on the membranes of your cells. And we see that levels below 5% start to develop higher risk of cognitive impairment and dementia and even brain shrinkage with aging for people who have 4%, 3%, 2%. And the amount of your ability to convert short chain ALA into EPA and then DHA is very genetically determined based on your conversion enzymes. So some people convert it more regularly and more easily. They don't really have to eat those fats, and other people are more dependent on them. But I'm cautious to make sure none of my patients or my people who follow my work don't get into trouble with developing later life. Because if they live to be, 95 or 100 years old, we don't want them having to suffer with dementia over the last 10 years of their life, like so many have. We want them living longer and keeping their full mental faculties intact. And the way we achieve that is keeping an eye on their omega-3 index as they're getting older, before they get to the old age, and make sure they supplement accordingly to make sure they keep that omega-3 index above 5.